Hey everyone, welcome to my class today. Today I'll be dealing with the next nursing foundation topic, that is healthcare agency. So coming to its definition, healthcare agency is a governmental or non-governmental organization that is responsible for providing health services and manage care by skilled health professionals under the supervision of physician or one or more registered nurses. Okay, so it is an organization which may be a government, or that means led by the government, or non-government is a private or voluntary agencies which are running the hospital like organization, so that they provide care by the skilled people and they are providing under the supervision of physician and nurses. And these organizations must maintain all the clinical records of the patient, and they must be licensed by the laws to maintain the rights of the patient, and also approved by the state laws that are governing them, so that they must get a license or certificate to run the organization. Coming to the types of healthcare agencies, there are two types. One is public health agencies and private health agencies. So public health agencies, these are governed by the government, and they use the money which are collected from the taxpayers to fund the healthcare initiative. So here the equipment, salaries, construction of the building, and also prescription and all the budget are set by the local government, and so because all these are set by the local government, there is only limited services provided in public health agencies. Whereas private health agencies, they are funded by some owner or a group of persons who will be owning the organization, and the owner of the facility will decide the budget, managing finances, and also they also comply with the strict code, law, and federal regulations. Okay, so that is what our certified agencies are telling. All those regulations they follow, and the owner will draft contract, they will recruit the staff, and they will purchase all equipment, investment, and they will control all services. So coming to the types of private healthcare agencies, so there are outpatient clinics, nursing homes, hospitals, ambulatory care centers, emergency care centers, dialysis centers, birth centers, diabetes centers, rehabilitation centers, laboratory and diagnostic clinics, de-addiction centers, mental health centers, dental clinics, hospice homes, and telemedicine centers. Let's see one by one. So in outpatient clinics, so they don't require hospitalization. Only thing is they come to the hospital and they get treatment for some minor ailments, and they can go home. So these are settings are easily accessible because they are present everywhere in the streets, wherever in the neighborhood. We can see this outpatient clinic. This outpatient clinic, routine doctor appointment and health checkups are carried out. And in these facilities, physicians may practice privately, or like a group of physicians will join together and they will be owning a corporate clinic, and in that there will be outpatient department where the outpatient services will be provided. That is in a large healthcare system or hospital. Next, coming to nursing homes. So these offer living situations for patients whose medical needs are in severe enough for hospitalization but are too serious to manage at home. Okay, so there are some diseases or small ailments or injuries which we cannot deal at home, but the patient also the condition is not so severe that he may not need a hospitalization. So in such conditions, they can be treated in a nursing homes. Okay, so here they will see patient if they have any injuries, any acute illness, any post-operative care needs like removal of sutures after the operation, or if something happened at post-operative period once they discharge at home, if they want to get some medical treatment, then they can go to these nursing homes. And these facilities also provide long-term medical care ranging from simple to complex levels. So that means they also treat simple and complex diseases, like long-term facilities, like if patient wanted to come for a regular checkup or regular treatment in case of chronic diseases, then they can come to these areas, and these areas provided care for patients from few weeks to months. Okay, so in case of long-term disease, they may provide care for more than months, and if it is a short-term disease or a small minor acute illness, then they will provide treatment for few weeks. Okay, next is hospitals. So these are healthcare agencies that provide services depending on the size on the location. Okay, so there are some small hospitals and there are some big like 100 bedded, 200, 300, and like that more than 1000 bedded hospitals are there. According to the size and where they are located, they will provide care for the people in that locality. So in hospitals, there are both intensive and non-intensive care units. So in intensive care units, these people need emergency care, and they are also life-threatening illness. So if person is having any life-threatening illness, they will be treated in this intensive care unit. On the other hand, if the patient is having some minor injuries or he is posted for a surgery and he is to be operated or he is in the post-operative state condition, so these patients will be put in the non-intensive care units. And in non-intensive care units, and there is also a step-down unit. So once the patient is stable in the intensive care unit, then these patients can be transferred to the step-down unit. And the hospitals have more of non-intensive units and less of intensive care units. Next, coming to ambulatory care centers. Ambulatory means it is like walk-in. So patient who needs some just observation for a small period of time, they will be coming to this ambulatory care centers. And ambulatory care centers also run ambulatory care surgical centers, where a person, if he is posted for some minor surgeries or minor procedures, he will come to this center. So typically the persons may be admitted to 6 to 12 hours or less than a day. They will be admitted in these ambulatory care centers, and they provide outpatient surgical facilities. So like in case of some cataract procedure or small minor surgeries, they will do in a ambulatory care center, and they allow person to give certain surgical procedures outside the hospital. Okay, some surgical procedures need not be done in a hospital. That means they need not need any sophisticated equipment. Like in local anesthesia, we can do the procedure. So these patients can get admitted in the ambulatory care centers. And because these centers only per day the person may be getting admitted, so the risk of exposure to infection is very less, and the length of stay in the hospital is also minimal. Next is emergency care centers. So these centers are present in most of the developed countries. So in these centers, the persons are admitted who cannot wait for treatment. Okay, so that means their condition is not so severe that they need emergency treatment, but also they cannot wait for the scheduled treatment. Like in outpatient clinic, they have to get an appointment and they have to wait for their turn. But in these emergency centers, they need not wait for the turn. For example, if a children is coming and he is having irritated and he wanted to meet the doctor immediately, then he can come to these emergency centers and they can get an appointment immediately and meet the doctor. Okay, so any children sick, and if they want some immediate diagnosis, like in case patient is having an asthma and you wanted to get immediate relief, then they can go to these emergency centers for nebulizer or oxygen therapy. So like this, these centers will help do the emergency treatment for the patient, and they mainly treat, like in case of broken bones, to treat limb fractures. That is, they can put a plaster of Paris and prevent mobilization of the limb. And also in case of any small illnesses like viral illness, they will diagnose with the help of blood and urine test, and they also prevent injuries like putting dressing, and other services will be done in this emergency care services. And if the problem is too severe, they will have ambulance facilities so that they can refer them to the hospitals. Next is dialysis centers. So nowadays people are suffering with kidney diseases and they want regular treatment of dialysis. So dialysis is a process where the kidneys are functioning artificially with the help of dialysis machine. So they do normal function of the kidneys. And some patients need dialysis 3 times a week or 2 times a week according to their severity of illness. They want to come for a regular dialysis, otherwise they will go for severe complication. So to meet this demand, so all the hospitals cannot be equipped with adequate dialysis. So there are separate dialysis centers for kidney patients so that they can go and get dialysis according to their schedule. Next is birth centers. So these are also present in many of the developed countries, and these centers provide healthcare facility for childbirth. Okay, so that is for delivering the child, and it focuses on the midwifery model, and the aim is to create a birth environment that is comfortable for both mother and the child. And in these birth centers, family will be included. So if the mother wanted some near neighbor or near relative to be present during the birth, they can be present during the delivery. And these birth centers, they won't have very sophisticated equipment, like in case of the patient is having any cesarean section, that is any operation to be done, or if the baby is in danger after birth, then they will not have some sophisticated equipment. So only uncomplicated pregnancies will be admitted in these birth centers. If they know the pregnancy is complicated, then they will be referring them to the hospitals, and only non-complicated cases will be taken in the birth centers. Next is diabetes centers or clinic. So diabetes is one of the serious illness in the population, and over 1/3 of the national population is risk of getting diabetes. So that condition is called as pre-diabetes, and these patients need management of disease and also make some lifestyle changes so that they can prevent from some life-threatening complications. So diabetes is so widespread, and there is a high burden in the hospitals to treat this diabetes patients. So nowadays independent diabetic clinics are there, so that they can help the patient to avoid risk and complications of diabetes. These centers, they offer classes, education, support groups, and also variety of resources for patients so that they can live without the complications of diabetes. These rehabilitation centers, so these rehabilitation centers provide therapies so that they can help to restore the patient's ability after an illness or injury. So they mainly offer physical therapy, occupational therapy, and speech therapy. So all these processes, they help the person to gain skills so that they can lead a independent life, so that they can move around, work and speak, and do all the activities of daily living. Practitioners in these rehabilitation centers, they help the people to regain their mobility and independence as much as possible. Okay, so to the extent after a disability they have to lead an independent life, so they help them to lead those independent life. And there are these outpatient rehabilitation centers, they relieve the strain in hospital. Okay, because hospital cannot, they do a large work. So when these rehabilitation centers, they treat the patient's inability or disability, then it will relieve the strain on the hospitals. Next is laboratory and diagnostic clinics. So these clinics are hospital counterparts. They provide diagnostic services to patients, and clinical lab services. They test specimens of patients' body fluids like blood and urine, etc. And these help to diagnose and treat patients. And mainly clinical laboratory services, they are most cost effective and least invasive. Cost effective means there will be less money than the hospitals, and least invasive is with a small prick or something they can collect the blood and they can make the objective information about the patient's condition, and based on that they can make the clinical decision, that is what treatment has to be provided. And in diagnostic imaging, so this includes CT scan, ultrasounds, X-rays, MRI, and there are also various other scans like PET scan, SPECT scan, nuclear scan. So any type of scans are done in these imaging centers, and they are like outpatient facilities, so that the cost is lower, and it's also more convenient for patients to schedule their time. Okay, because in hospitals there will be so many patients, and every patient cannot get the diagnostic imaging done as per time, so it can delay the time. So in these imaging diagnostic clinic areas, you can get according to the convenient time. And hospital facilities will, so in the hospital they will handle all the emergency MRI, like in case patients have a brain injury and wanted to see whether it is a bleeding. So immediately if they want some diagnostic procedures done or imaging studies done, then the hospital will take care. But if the patient can wait and he has a scheduled treatment, then these diagnostic clinics can provide diagnosis by doing the imaging studies. But in case any imaging is planned advanced, like in case of ultrasound to monitor the pregnancy, so like that if there is a scheduled time where the mother can go and get the ultrasonography, and if hospitals are busy, then these centers will help the patient in diagnosis. Next is de-addiction centers. So here they provide intervention, treatment, and restoration of social incorporation of addicts and alcoholics in the standards of the general public. Okay, so these addicted patients, they may be a burden for the society, so they will, so restoring their social activity and to maintain the standard in the general public, these de-addiction centers are helping the patient who are addicted. So they prepare the addicts to break free from their old patterns or habits. Okay, so if they have whatever habit they are addicted, they help the person to break from those addictions. And throughout the treatment, the individual gains an optimistic outlook in life. That is, they provide so many group therapy and other therapies for the patient, so that they make the person to understand their self-worth and also uplift their self-worth and diminish all the old routines. Okay, so they will make the patient to think that what all activities they are doing is wrong, and they will help them to come out from their old behaviors. And the perfect treatment ensures that individual is motivated and determined towards achieving a better life again. So that is, if the person say that I will do my normal life again, and if the patient is having a life changing experience, and he is having a support and willingness to become better and take advantage in the process, then it is good for the person, and the treatment will be perfect for the person. So like these de-addiction centers, mainly for alcoholics, drug abuse, and any gambling, so any type of behavioral abuse is there, behavioral or drug abuse is there, these de-addiction centers will help the patient to come out of their addiction. Next is mental health centers. So these mainly look after patients who are mentally ill, and they sometimes are like a general institution. That means they look after all the mental health issue, and sometimes there are also specialized mental health centers. So these centers will be like in case of suicidal thoughts, patient is having suicidal thoughts, so for them they will have a separate counseling and treatment. And in case of depression, their treatment will be different. And in case of any trauma or post-traumatic stress disorder, their treatment will be different. And treatment of anxiety disorders or behavioral disorder, etc. So according to the type of the disorder, there can be a specialized mental health center for each type of disorder, or sometimes it will be a mental health center generally for all the patients. So here they also provide inpatient and outpatient services based on the type of mental illness and what all the mental health facilities available. These hospitals mainly help the patient. They assist the patient to come out of their mental illness, so that is to go through their stages of healing process. And as per the mental illness, there are different wards, and treatment will be provided both as individual and as a group therapy. So in case if the person is so arrogant or he is very violent in nature, then they put the patient in a individual or independent therapy will be given. And if the person is not arrogant and he has to be treated in a group, then group therapy will be provided. And counseling services are also provided in this facility to prevent serious mental disorders. It is dental clinic. So here the dentist will work with the patients and the general public to prevent and treat the dental and oral diseases. So here they will correct the dental irregularities, that is if there is any deformation in the teeth, they will correct that, and also they will treat the dental and facial injuries. Okay, so if there is any injury, they can also do some surgical treatment, and also they do a complete examination by doing x-rays and dental clinics and fillings, root canals, and extraction. Okay, that is in case of tooth cleaning, tooth removal, or any tooth filling. So all those things will be done in this dental clinic. And there is also cosmetic dentistry. So here they will do tooth whitening by using porcelain and composite veneers, and also they will implant the tooth. If so, in case of tooth decay and removal of teeth, they will implant, that is placement and restoration of tooth will be done in these dental clinics. Next is hospice homes. So hospice homes are for end of life or dying patients. So mainly they have an official network where so many people can be contacted according to the needs of the end of life patients. So here they are not only the medical treatment is provided, they also provide emotional, spiritual support for patient and their families. That is, at the end of life, they help the patient to live peacefully. And here there are a team of members who are providing care for the hospice patients. That is a physician, a hospice physician, and a nurse, a home health aide, that is to meet the activities of daily living of the patient if the patient is disabled, and any social worker, so who will meet the voluntary needs of the patient. And clergy is a pastor or a priest of the organization, and other counselor and physical occupational therapists as per the needs of the patient. Though hospice care can be met at home of the patient, yet if the person's any medical need is significant, that means if the patient needs a medical treatment also with hospice, then they will come to this hospice centers. Finally, in the private healthcare agencies, there is telemedicine or telehealth centers. So this is one of the emerging healthcare facilities. So that is in the coming years, it is a serious need for the society. Okay, telehealth is an electronic communication technology that facilitates long distance healthcare and health. Okay, so that is through email or through electronic communication using a website database. They communicate with the physician, and the clients will communicate regarding their health. And many people, they lack access to physician and also specialty clinic, and because if their location is somewhere in the hilly area or any rural areas, and if they have a physical disability, so that they cannot come to the hospital, and also if there is lack of transportation, so when these hard times are there, then they can meet the doctor through this telehealth services. Okay, when they are not able to meet the doctor face to face, then they can use these telehealth services. Here the patient's limitations, the greater care cost, and the new technology capabilities have all come together to motivate the telehealth applications. Okay, so because nowadays healthcare cost is a very costly, and when patients come to hospital, they hospitalize, and their and also transportation, everything is so costly. So these telehealth services are a great motivation nowadays. So here it is like a video conference where the patient and the physician can communicate each other, and the patient will tell about his illness, and the doctor can advise the medical treatment. And also in consultation, if the doctor wanted a ECG or some special procedures, then there will be a device where the patient can connect, and he can take the ECG or whatever is needed. He can, using the device, he can log with the web-based services, and to any doctor or any nurse practitioner he can send the details, so that the doctor can prescribe the medications and also suggest the home care treatment and any additional treatment needed at home. Next, coming to the types of public health agencies. At the primary level, there is sub-center and primary health center. In the secondary level, there is community health centers and sub-district hospitals. And in the tertiary level, there is general hospitals and medical colleges and research institutions. Next, in public healthcare agencies, at the primary level, the first one is the sub-center. Sub-center are designed to serve the community in the extremely rural areas, and all the expenses are carried out by the national government, and they require staff, that is at least 2 workers, 1 male and 1 female, and these sub-centers cover a 5,000 population, that is one sub-center for 5,000 population. In the remote areas and extremely remote and dangerous areas, they will have one sub-center for 3,000 population, and these sub-centers, they educate the rural people about the healthy habits, and also they work long term in that community and look after the health concerns of the community. Next, at the primary level, there are primary health centers. So these primary health centers, they are developed for the rural population, that is for 30,000 people or more. These primary centers will be there, and in remote areas for 20,000 population, there is one primary health center. So here there are doctors and paramedics are working in these primary health centers, and the patients will be referred from the local sub-centers. So if there is any complex disease and there are sub-centers cannot treat, they will refer the patient to the primary health centers. And the difference between sub-center and primary health center is, in sub-center the money and expenses are funded by the national government, whereas in primary health centers the expenses are taken care of by the state government. And primary health centers, they function to improve the healthy habits by providing health education, and also the emphasis on preventive measures in the community. At the secondary level, there is community health centers. So this is funded by the state government, and they accept patients that are referred from the primary health centers and also sub-centers. They serve a population of 1,20,000 people in urban area and 80,000 people in the remote areas. If there are any complex diseases and there is not sufficient medical equipment to treat those diseases, then these complex patients will be transferred from the community health centers to the district and general hospitals. And these community health centers serve as a first referral unit, that is first area for the referrals from the sub-center and primary health centers. And they also take care of obstetric care, newborn child care, and blood storage, that is blood bank capacities at all hours every day of the week. So these all the care will be done in the community health. Okay, next at secondary level there are sub-district hospitals or subdivision hospitals. They are below the district hospitals but above the community health centers, and they are also as first referral units, and they receive person from sub-center, primary health centers and also community health centers, and they provide emergency obstetric care, that is any emergency cesarean section or any delivery to be conducted, they will conduct, and neonatal care, and also they help in reducing the maternal and infant mortality rate. Okay, so they meet all the emergencies, so the death rate of the mother and also the infants can be reduced. And in the subdivision hospitals, they cater for 5 to 6 lakh population, that is people with 5 to 6 lakh in a bigger district. The sub-district hospital fills the gap between the block level hospitals and the district hospitals. Okay, so that is when the district is very big and with a higher population, they will be like a mediator in between the block level, that is in the community health centers, and to the general or the district hospital. And it also saves the travel time of patient. Okay, so in case if the person need any tertiary hospital services, they have to travel long because only one district will have one general hospital, so they have to travel long to these hospitals. So this will like a gap they will mediate in between, that is before they can reach the district hospitals, any emergency services will be done in this subdivision hospital, so that they will minimize they can save the travel time, and also if there is any emergency care, they will be met in the sub-district hospitals, and this can also prevent workload for the district and general hospitals. And there are about 1,200 such hospitals in our country with a bed strength varying from 31 to 100, and they provide secondary healthcare services to the community and maintain an acceptable standard and quality of care in this hospital. At the tertiary level, there are district hospitals. So these are final referral units from the primary and the secondary level care. These tertiary hospitals will receive the patients, and they are expected, that is at least one hospital in one district should be present in India, and with a bed strength of 75 to 500 beds. So according to the population demand, they can increase the bed strength. And these district hospitals, however, they lack the modern equipment and relations with the local blood banks. Okay, so because of that, major surgical procedures and major treatment has to be referred to other hospitals. Final agency in the tertiary level is the medical colleges and research institutes. So these are government medical colleges, and they are owned and controlled by the respective state government, and they also function as the referral hospitals. Okay, so from the other areas they get the referral patients, and these also will refer the patients to the other hospitals. And this organization, they incorporate public health policies and also diverse professionals in collaboration with international and public health organizations to gather more knowledge and direct discussion around needs and improvements of the current system. So they get all the they have collaboration with the World Health Organization and other international agencies, so that they can improve the standards, and also they can gather more knowledge and also improve the current system, and thereby they every day improve their health system. And these colleges, they further their programs and educate more people in their field. Okay, that means they start so many new courses and educate the people, and the research discovered would be made transparent to the Indian public at large, so that the entire nation is aware of the health rewards and standards in the country. Okay, so whatever research they do, they keep on updating in the journals and newspapers, so that the entire country will know what the health system in the country. This is all about the types of healthcare agencies. I hope you have understood. Please like, share and subscribe.